human immunodeficiency virus, commonly known as HIV, continues to be a major global health issue. Despite advancements in medical science, it remains a leading cause of death and a barrier to economic development in many parts of the world. HIV attacks the body's immune system, specifically the CD4 cells or T cells, which help the immune system fight off infections. Untreated, HIV reduces the number of these cells in the body, making the person more likely to get infections or infection-related cancers. Over time, HIV can destroy so many of these cells that the body can't fight off infections and disease, leading to the most severe phase of the HIV infection, acquired immunodeficiency syndrome, or AIDS. AIDS is the stage of infection that occurs when your immune system is badly damaged and you become vulnerable to opportunistic infections. When the number of your CD4 cells falls below 200 cells per cubic millimeter of blood, you are considered to have progressed to AIDS. Normal CD4 counts are between 500 and 1,600 cells per cubic millimeter. Besides the drastic reduction in CD4, the presence of certain opportunistic infections also characterizes AIDS. People living with AIDS can have a high viral load and be very infectious. The global impact of HIV/AIDS has been profound. According to the World Health Organization, millions of people are currently infected with HIV worldwide. While the disease affects populations globally, sub-Saharan Africa remains the most severely affected region. Here, a high number of people still receive little to no health care, contributing to the spread of the virus. The social, economic, and health repercussions of HIV/AIDS are immense, making the disease not only a medical issue, but also a socio-economic challenge that requires a comprehensive approach to manage. HIV exists in two main types, HIV-1 and HIV-2. Both types of the virus attack the body's immune system, but they have some differences in their geographic spread and virulence. HIV-1 is the most widespread type globally and is more aggressive than HIV-2. It is responsible for the vast majority of HIV infections worldwide and is highly infectious. HIV-1 can be further divided into several subtypes and groups, each with its own specific geographic distribution and impact on the population. HIV-2, on the other hand, is less transmissible and is largely confined to West Africa. It progresses more slowly and is less likely to develop into AIDS compared to HIV-1. However, HIV-2 is still a serious health concern in areas where it is prevalent because, like HIV-1, it ultimately leads to immune system failure if left untreated. The symptoms of HIV-2 infection are similar to those of HIV-1, but its lower virulence means that it progresses at a slower pace. Understanding the differences between these two types is crucial for the development of effective treatments and public health strategies. This knowledge helps medical professionals and researchers develop targeted interventions and tailor public health messages that are specific to the type of HIV prevalent in an area. It also underscores the importance of genetic research in the fight against the HIV pandemic, as different subtypes may respond differently to treatment. The primary mode of HIV transmission is through contact with certain body fluids from a person with HIV who has a detectable viral load. These fluids include blood, semen, vaginal and rectal fluids, and breast milk. The most common ways to contract HIV are through unprotected sexual contact, sharing needles or syringes for drug use, and from mother to child during pregnancy, childbirth, or breastfeeding. Despite common misconceptions, HIV is not spread through casual contact such as hugging, shaking hands, or sharing food or water. Certain behaviors and conditions can increase the risk of HIV transmission. Engaging in unprotected sex with multiple partners, particularly within high-prevalence communities, drastically increases the risk. Intravenous drug use that involves sharing needles is another significant risk factor. Also, individuals with sexually transmitted infections are more likely to acquire HIV than those without STIs, because the presence of an STI can compromise the integrity of the genital tract. Understanding who is most at risk is key to targeting prevention strategies effectively. High-risk groups include young adults, particularly in regions with high HIV prevalence rates, such as sub-Saharan Africa, and marginalized populations such as the LGBTQ+ community and intravenous drug users. By focusing preventive efforts on these groups and educating them about the risks and the importance of safety measures, health authorities can significantly reduce the rate of HIV transmission. Preventing HIV is crucial to controlling the spread of the virus. The cornerstone of HIV prevention is education about safe sex practices and the availability of prevention tools like condoms and pre-exposure prophylaxis, or PrEP. Condoms are highly effective in preventing the transmission of HIV and other sexually transmitted infections when used consistently and correctly. PrEP is a medication taken daily by HIV-negative individuals who are at high risk of HIV infection. It has been shown to reduce the risk of getting HIV from sex by about 99% when taken as prescribed. The role of regular HIV testing cannot be overstated. It is the gateway to HIV prevention, care, and treatment. Knowing one's HIV status provides powerful information. HIV-positive individuals can access anti-retroviral therapy, which not only helps in managing the disease, but also significantly reduces the risk of transmission by reducing the viral load to undetectable levels. For HIV-negative individuals, this knowledge can reinforce safe practices or lead to decisions like starting PrEP. Community involvement is also critical in HIV prevention. Community-based approaches can help reach out to underserved populations, promote HIV testing, and distribute condoms and other preventive materials. These activities are especially important in areas with high HIV prevalence. Engaging community leaders can aid in breaking down stigmas associated with HIV and encourage more people to come forward for testing and treatment. The fight against HIV/AIDS is not just a medical battle, it's a societal challenge that requires collective action. Understanding the basics of HIV/AIDS, its types, transmission modes, risk factors, and prevention can empower individuals and communities to take proactive steps towards eradicating this disease. Awareness and education are the bedrock of effective HIV prevention. By dispelling myths and educating people on how HIV is transmitted and how it can be prevented, we can reduce stigma and fear. Continued investment in HIV research and healthcare infrastructure is essential to develop more effective treatments and, ultimately, a cure. Meanwhile, preventive measures such as safe sex practices, regular testing, and treatment for those who are HIV positive remain our best tools for controlling the spread of HIV. As global citizens, it is our responsibility to stay informed, support those affected, and contribute to a world where HIV no longer poses a threat to public health and safety. Together, through education and compassion, we can make a significant impact on the HIV/AIDS pandemic. Let's commit to this cause not only on World AIDS Day, but every day.